Hi, in this video today, I'm going to be talking to you about some really interesting brain science. What is neurogenesis versus neuroplasticity? Well, before I go into that, let's tell you, I'm Dr. Julie Steinauer. My clinic is Vision for Life and Success. And if you are local to us, you can contact our office at 618-288-1489. But if you're not local, don't worry, you can still connect with us. And you want to go to our website at visionforlifeworks.com. The best thing to do there is to schedule a consultation to meet with me directly. Now, let's talk about this. I've really been digging in pretty deep, actually, in researching in the last several months a lot about the brain, how the brain heals itself, and just so many details about the brain. There are some fascinating books out there. One of which I have sitting in front of me is called Wired to Grow. Now, this author, Britt Andreatta, has actually written several books. And so this is one, and maybe I think like a series of 3 books. Wired to Grow, there's one Wired to Resist, and also Wired to Connect. But this is really fascinating information. And she talks a little bit about the difference between neuroplasticity and also neurogenesis. I'm also reading another really interesting brain book about it. Why? Because I have so many patients who have traumatic brain injury of one form or another. Maybe it's from a traumatic brain injury due to a stroke, or maybe it's from a car accident, or maybe it's something we don't tend to think is traumatic, but a bump on the head or a fall where we hit our tailbone and it jars our brain. Those are actually different forms of traumatic brain injury. Again, even though we don't think that they're that traumatic, they actually can be. So I've been doing some deep dive research into the brain and how does the brain heal? Well, I want to share with you what's, I think, a lot of new information that's coming to light more readily in the last probably year. And it explains a lot as far as how our program is so successful in helping our patients to not only recover from things like traumatic brain injury, but also to recover from vision loss from something like a stroke. Now, in neuroplasticity, what that means is the brain has the ability to learn new things. You may be thinking about, you've heard that statement, you can't teach an old dog new tricks. Well, that's not true. You actually can, fortunately. And so people of any age can learn all kinds of new information. At the age of 60 or 70 or 80, a person could decide they wanted to learn how to play an instrument. They could learn maybe how to speak a new language. There's really no age that you can't do that. There are other factors, though, that may be a limiting problem, and that would be something like Alzheimer's or dementia. But at any age, we can learn new things, which is why vision therapy coupled with syntonic photo light therapy, the way that our office does it at Vision for Life and Success, is so successful in helping our patients, because we're tapping into the fact that the brain has the ability to learn new information at any age. That means I can train your brain how to learn new visual information to process vision better. It doesn't matter if you have amblyopia, where you don't see well in one eye, and you're 7, or if you're 67. Because of neuroplasticity, it means that we can actually train your brain, even at an older age, how to not have amblyopia or to see better. Well, what is this neurogenesis part that I talked about earlier? Where neurogenesis is where the brain not only has the ability to learn new tricks and things like that with neuroplasticity, but it's actually the laying down of new nerve pathways, which is really important, because we tend to think that if something happens, like there's nerve damage, there's nothing you can do. It's just, you got what you got, and there's nothing that can be done. But according to new research about neurogenesis, that's not at all the truth. So if there's neurogenesis, where your brain has the ability to lay down kind of a new nerve pathway, well then if something happens, let's say a stroke, and your visual pathway is affected, and the brain has the ability to lay a new pathway, well, that might be a way in which we can help you recover. So now let's talk about our program with Vision for Life and Success. If you have a traumatic brain injury or a stroke and you've lost vision, for a number of years, I've said it's kind of like we're laying a new pathway, or we're creating a new, nerve track within the brain without really, truly 100% having a lot of science to back it up. I would always say things like, I don't really know how it's happening, but it just seems to be happening. And so with syntonics or photolight therapy, because we're triggering the brain electrically to turn on these kind of like improved pathways, but we're also now knowing through neurogenesis, we're really creating new nerve pathways. So if someone's had a stroke and lost vision, then let's kind of create a new visual pathway in which we can tap into that, turn it back on, and teach the brain a new ability to perform with new sets of visual skill. Doesn't that sound amazing? Well, that's kind of exactly what we're doing at Vision for Life and Success. Now, if you are thinking, well, you have had a stroke and you lost vision and it was a month ago, 6 months ago, or maybe it was 5 years ago, and you're thinking, well, it's probably too late for me, especially if it was 5 years ago. That is not actually the case any longer. Again, because of neuroplasticity and neurogenesis, these two things make it possible to help your brain be able to process vision again. Now, will it be the same for you if it's been 5 years or 13 years post-stroke, in comparison to someone that's been a month or 3 months? Not at all. It won't be the same type of program. It won't be the same kind of result. It won't be even the same length of time, because the individual who probably had that stroke a month ago is more likely to resolve in a faster pattern than the individual who had the stroke 10 or 15 years ago. So would I rather work with someone 15 years down the road or 3 months down the road? If I can work with you a few months after you've had your stroke or traumatic brain injury in which you lost your vision, all the better. But we can still help the individuals who it's been maybe years past due to some amazing new science. If you like to geek out on like sciencey type stuff, then this might be a great book for you to look into. It doesn't just talk about like what I've discussed though. There's a lot of depth in this book about many other things. If you like this video, definitely hit the like button, subscribe to our channel, and if you want to connect with us, you can do one of two things. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, schedule a consultation, and learn how we can help you to recover your vision through the cool new, what we know, neurogenesis and neuroplasticity, which we've known about for a while. And if you feel like this would be beneficial, pass this video on. Thank you.